If you are hiding your legs because of unsightly, even painful veins, there is something you can do about it. Here to explain is Dr. Paul Sauce from Optima Vein Care. It's good to see you, Dr. Sauce.
Good to be back.
You're the founder of Optima Vein Care.
Yes,
First,
I am.
we should mention, too. We're talking about varicose veins, specifically. What causes those?
Varicose veins result from the fact that the venous system is unable to return the blood adequately to the heart. Pressure builds up in the legs. There's little one-way doors that we're seeing on the screen here that fail, and this pressure causes the veins to dilate and to become visible.
What's the difference between varicose and spider veins?
Spider veins are just smaller veins. They're just lying on the top layer of the skin, whereas varicose veins are a little bit deeper and a little bit larger.
Okay. So now we've got some pictures here of some of the symptoms or signs that you might have these varicose veins. Obviously, you can see the dark veins on the left there.
It's easy because patients actually see the problems on their legs. They can see the varicose veins. They can feel the swelling of the legs. They can see these ropey things that we see. So when they come in to see us, they pretty much know that they've got a problem.
Okay, we're taking a look at some more pictures here. Those were pretty some obvious,
yes.
you know
we see this
right.
every day.
Yes. What are some more symptoms that you might have varicose versus maybe the spider?
One of the things that we realize is that patients don't put the connection between what they're seeing with what they're feeling. They don't realize that these varicose veins are also causing their legs to feel heavy. They're causing their legs to throb, to ache. These symptoms get worse during the day. They can cause tingling. They can cause restless legs at night. A lot of these symptoms are ignored by the general public and by most of the healthcare professionals.
Yeah, that makes sense. Now, can they be serious?
This is a very serious problem. Varicose veins can lead to blood clots. It can lead to pulmonary embolism. There's a significant amount of work loss that's due to varicose veins in these diseases. They can evolve to skin changes such as rashes and progress to even open wounds on the legs if they're not taken care of.
Very serious. So what is the treatment plan for varicose veins?
Treatments are very simple. They are basically aimed at reducing the excess of pressure that's built up in the veins. So we localize where the valves are broken in, and then we go and we use different techniques to close those veins.
So there is help out there for folks. So you don't have to live with this. There's a lot you can do nowadays.
Treatment has evolved to be completely different than what it was 10 to 15 years ago. We're here to let patients know that they're very sophisticated treatments. These are all done in the office. They have little downtime, and the results are spectacular.
And now what makes Optima Vein Care so different from other places that are out there?
There's several things. I think one thing is the fact that we only do this, so that we've really processed we've really gotten the process down to where it's done quickly. Patients are seen in the office on their first appointment. They have an ultrasound. They know already what they have. They know what their treatment options are. We're very proficient about submitting treatment options to the insurance and working with them to get this maximally covered.
That's what I was going to ask you. So it is a lot of it can be covered by insurance.
If this meets certain criteria, which most of these patients do, insurances are very good about taking care of this and participating with the patients to get these problems solved.
So if that's you out there and you've been living with this and you never wear shorts, you never wear a dress because you're so embarrassed by your legs, there's so much you can do about it now. And there's more than just one location. There's 3?
Fortunately, we have 3 locations, so it's very easy to get into our offices.
Great.
We have all of our physicians are specialized in this treatment. There's board certifications now in this particular domain, and they're all proficient in this type of thing.
And get it done now. Don't put it off. They're only going to get worse.
Yes.
Thank you, Dr.
Thank you.
Good to
Thank
see
you for having me.
Absolutely. So if you want more information on Optima Vein Care, you can go to their website. It's optimaveincare.com. There's the phone number right there on your screen.